So next we have Miss DeAnna Hoskins, who has been at the helm of Just Leadership USA as the president and CEO since 2018. A nationally recognized leader, Ms. Hoskins has been committed to the movement for racial and social justice, working alongside those most impacted by marginalization for over 2 decades. Ms. Hoskins leads from the perspective that collective leadership, advocacy for justice with reinvestment, and bold systems change are only possible when those who are most harmed are provided the tools and resources to demand change. Ms. Hoskins will be discussing pandemic preparedness within correctional facilities, and I'm turning it over to you.
Thank you, Lisa. And thanks, everyone. I've been watching the chat and my mind is just going in circles of, oh my God, individuals still making decisions for directly impacted people of what they think should happen. And I'm sitting here screaming at the chat, simply just ask. Simply just ask. The voices are actually valuable in this moment. But coming to this conversation, one, as a formerly incarcerated person, but two, I think I bring a unique expertise because after my incarceration, I was able to go back and work inside a correctional facility as a case manager and a unit manager. So dispelling the myth of who we can be after incarceration and moving on to work with the Department of Justice. But I want to start at the height of COVID, being in New York City, everyone was calling for decarceration. We have to let people out of prison. And we understood that prison officials, directors of Department of Corrections, have no power. They are legislatively bound or judiciary bound. They can, however, address the directives of how the facility operates, but as far as releasing people, it was those two entities that made those decisions. Upon further research, we went back to Hurricane Katrina disasters, Hurricane Ike. And what we realized was correctional facilities were not required around accreditation to have emergency management plans that focused on the individuals in their care. They do have plans if the correctional facility itself is in some type of danger and if it's a hostage situation. But as far as decarceration strategies to preserve the lives that have been sentenced, again, when a judge makes a decision, he is sentencing you to the care, custody, and control of the State Department of Corrections, meaning they are responsible for your safety, they are responsible for your health care, they are responsible to make sure that every situation that is needed to take place to preserve your life should actually be taken. And the lack of emergency management planning showed there was a flaw in the system. So Just Leadership launched what we call the Just Us, requiring that emergency management plans such as nursing homes, schools, other facilities that have congregate living have these plans in place. Schools do fire emergency. What is the plan if a fire breaks out? What is the plan when a pandemic or a disaster breaks out? We saw in Louisiana during Hurricane Katrina that the Louisiana Humane Society had a plan to get cats and dogs out of Louisiana, but individuals in correctional facilities were taken to a bridge and prayed that the water did not rise. So where was the human dignity and the humanity for the individuals who were remanded to the custody and care and control of the state? There was none. 15 years later, COVID hits, Louisiana still didn't have a plan. No other state had a plan to preserve the lives. But here was the one disturbing factor. In New York City, on Rikers Island, hand sanitizer ran out across this country. Individuals in correctional settings were actually making hand sanitizer, but it was a contraband and they couldn't use it. Individuals inside correctional facilities could dig the graves to house the people, but there was no plan for their lives not to contract this disease. So when we look at the humanity of this and the historical aspect of individuals who are incarcerated, our humanity is stripped from us. The fact of being a human is stripped from us, which is why we're seeing governors or we're seeing plans that make us low priority, right? But then you even have to, when you talk about the vaccine trials, and I love how Dr. Holly talked about it, and Michelle, let's go. We can't have these conversations without digging into the racial disparities. We can't have these conversations without the mistrust of Black and brown communities around healthcare, correctional, law enforcement. History has shown us that individuals who are oppressed and marginalized will be utilized to get data for the higher economic status of individuals and then not have access to it. So if we're talking about vaccine trials, if we're talking about access to this, our voices have to be heard. Our voices have to. We don't talk about women reproductive rights. We don't talk about veterans' disabilities without them at the table having a point in the conversation. So why do we keep making decisions for people who are in correctional facilities? I'm a human. I made a mistake. I served my time. I still have a right to have access to healthcare, have a right to have access to preserve the life, because again, I wasn't sentenced to death. I was sentenced to serve a detriment amount of time to actually as a punishment for the mistake that I made. Once that comes, I'm supposed to be able to walk out of that facility healthy. I do want to bring this up. When we talk about the importance of the voices of those impacted or stakeholders, there's an education that has to take place. And I'm gonna be honest with everyone on this call, everyone tuning in, that education can't come from you. That education has to come from us, people who have been directly impacted, sitting in that seat, sleeping on that bunk, to actually educate our population. But there again, people only want us to give credit to their research and their data and not include us in their research and their data. So I can't take your information and walk inside a correctional facility and start preaching that this is the process when I haven't been involved in how you even collected that data. Our voices haven't even been involved. So I want to thank Yale. I want to thank a lot of the committees that they have been very fortunate, very forthright in making sure our voices are heard. And people ask me that all the time, DeAnna, we're sitting at tables, we're having these conversations, are our voices being heard? Our voices are being heard. Our concerns are being heard. And we push back on some of the things, and we have an education. We come to this with an open mind. So don't dispel the power of the people or the problems you're trying to solve. Because as Michelle said, our founding principle is those closest to the problem or closest to the solution, but furthest from resource and power. And today, when we're talking about this pandemic, we have to have a seat at that table. We have to have a voice, and we have to have a choice if we want to participate in the actual process of how we get to a solution for this COVID-19. And I'll stop there.